Doing a nasal cannula, a nebulizer treatment, and a rebreather mask for Mr. Jones, who is not being able to get his full breaths in. Provide privacy. Hey, Mr. Jones, how are you doing today? You don't feel too good? It's hard for you to breathe? Can you please state your name and date of birth? It's John Jones, 3333. Thank you. So you said it's really hard for you to get a deep breath and you feel like you're kind of wheezing? Let's go ahead and sit you up, okay? So I'm going to sit him up and put him in a high-balance position. There'll be a pillow behind his head so we can get a nice open airway. Are you feeling okay sitting up? Yeah? I'm going to bring the bed to working height. Want to do some deep breathing with me? And then cough? Okay, that's still not working, that's still not feeling very good. I'm gonna go ahead and listen to your lung sounds, okay? While I'm doing this, I'm gonna go ahead and put a pulse oximeter on him so we can check his oxygen saturation. This one also checks his heart rate. So this is just gonna go on your finger, okay? I'm checking for capillary refill, for cyanosis. So this just goes on your finger and it's going to let me know how you're doing. So then I'm going to go ahead. Before I go assess, I'm going to check to see if he has equal chest rising, and he does. Alright, so I'm just going to check the way your lungs sound, okay? Trying to lean forward for me, I'll check the back. And he can help me lean forward. Alright, good job. Thank you. Does sound like he's wheezing a little bit, like it's a labored breath. So I've done all my interventions that I could. His oxygen saturation is at an 82%, which is very low. It's not good. So I'm going to go ahead and right away put a nasal cannula on him and give him 2 liters of oxygen. Alright, so what this does is just goes right on your nose. It's going to stick up, and he doesn't have any blockage in his nose, so I know the oxygen will go ahead and get up where it needs to be. And it's just going to rest on your ears, okay? It should help you feel better and be able to breathe a little bit better. So I'm going to go ahead and hook this up. Turn it on. I can feel that it's working. It's on 2 liters right now. Sorry if this is in your way. So this needs to be pointing up, and then I make sure there's no skin breakdown, so I'll know a baseline. And he doesn't have any skin breakdown. How does that feel? Does it feel okay for you? Yeah, I know it's a little bit uncomfortable, but it should help you breathe better, okay? So I would put the bed down to work back down to a safety level. I would document what I did, and I'd let the provider know right away. Because the oxygen is a medication, but I needed to make sure that his stats went up. I'm going to come back and check on him in 15 minutes. So I take my gloves off after I documented it. I'm going to come back in. Hi, Mr. Jones, how you doing? I checked his pulse oximeter, and it has only went up just a little bit. It's at an 88%, which is still not good. I'm going to do hand hygiene. You're still not feeling very well? No. Yeah, your dog's not in the room with you. He's delirious. He's not doing as he should. So next I'm going to go ahead and put the rebreathing mask on. So if we were to have an actual rebreathing mask, it would have a bag on it. I would hook it up to oxygen. I would make sure that it was a 1/2 to 3/4 full before I put it on. We're going to take this off you, okay? This is going to be at 10 liters of oxygen. Alright, it's just going to go over your face. He's not, he doesn't have very much anxiety, so this isn't going to make him feel claustrophobic. It's just going to go over and then go sit right on your ear, okay? How does that feel? And he nods his head. He's okay. It's working correctly. The oxygen is going through. You can see the mask fog up just a little bit. I'm gonna come back and check in 15 minutes. I'm gonna let the provider know right away what I did. Put the bed back down to where it's supposed to be. So it's been 15 minutes. I let the provider know. I come back in the room. Hand hygiene. So how are you feeling? Feeling a little bit better? So his pulse ox says it's still at 88. I'm gonna go ahead and I'm gonna check his lung sounds. And I checked him, and he still has the wheezing, and he can't get a full deep breath. So next we're gonna do is the nebulizer treatment. I checked. Can you please state your name and date of birth one more time? And he said it was John Jones, 3333. Thank you. So I'm gonna come back after I come in the room, and I'm gonna get your nebulizer treatment ready. Okay? This is a clean work surface. That my package is not opened, it's not tampered with, there's nothing wrong with it. I checked his MAR since this is a medication, the provider ordered it. It correlates. I've done my 3 checks, the 6 rights, we're all ready. So for this, you'd break the medicine open and you'd stick it in here, and it would fill up. Dispose of that properly. He is conscious enough to be able to hold this on his own. If not, we could put it onto a mask, and then he would be able to just sit there and let the medicine come. This gets hooked up to room air. How you doing, Mr. Jones? We're gonna try to get you to feel better, okay? Make sure my oxygen's turned off and this is turned on. Alright, I'm gonna take your mask off, okay? Can I have you hold this up to your mouth and breathe into it? It'll take a few minutes. I see the steam coming out. It's working properly. After he's got that done. If your heart is racing a little bit, it's okay. It's gonna be a steroid. Might race just a little bit. I noted before that his heart rate was in a proper level. It was about 70. He had finished this. His heart rate was at 70. I'm going to come back, dispose of this properly. Hand hygiene. So his heart rate is still, it went up just a little bit. It's at 75. How are you feeling? You take those nice deep breaths now. It feels a lot better, huh? So his come back, checked on him in 15 minutes. His oxygen level is now at 96%. Our treatment did work. I'm gonna let the provider know right away. I'm glad you're feeling better, okay? Here's your call light. If you need anything, I put him back down to where he's supposed to be. There's no need to put him back on oxygen because his saturation is what it should be, and that was after the 15 minutes. We'll come back in and check on you in a little bit to make sure you're still doing good, okay? Would you like to be laid down or still sit up? Sitting up feels good? Okay, we'll leave you sitting up. Hand hygiene. Let the provider know that nothing went wrong. Document what we did. And I would check his lung sounds to make sure that they were the same, that they weren't wheezing anymore, and they weren't. So our treatment did work. His bronchioles got opened, and that would be it.